Hey there, my name is Mackenzie and I'm the Invisalign manager here at James River Orthodontics, and today I'm here to review your Invisalign instructions along with some tips and tricks for how to make the most of your Invisalign treatment. We first want to congratulate you on getting started with your Invisalign treatment. Invisalign treatment is a transformative journey and we're so excited and don't take it lightly that you chose us to support you in this experience. First, let's review what comes in your welcome bag. One of the things that you're going to find in your Invisalign bag are your Invisalign boxes. These boxes contain the aligners that you'll be wearing. You may have one box and you may have four. It just depends on what the doctor has prescribed for your first set. So you may look and see that you only have 24 trays, but you were estimated 18 to 24 months. So we want to set a realistic expectation for you that this is not going to be your only set of trays. We want you to focus on the estimated treatment length that the doctor gave you in your consult rather than the amount of trays that you have. The reason for that is we're going to use this first set of trays to get through all of the major and significant movements, and then we're going to do a refinement where we're going to have you come in, we're going to do a new scan, we're going to take some photos, we're going to talk to you about what you see, we're going to see what the doctor wants to make, the adjustments that he wants to make in the next set of trays, and then we'll go ahead and do a new scan and order a new set of trays that have those really fine-tuned movements for you. So when you open your box of trays, you're going to see that you have multiple trays in consecutive order. Each of these bags is going to have an upper tray and a lower tray in it. If you're only in lower treatment, then you're probably only going to have a lower tray. If you're in upper treatment only, you're only going to have an upper tray. But for most of you that are in upper and lower treatment, you're going to see two different aligners in each bag. If you ever misplace the aligner from outside of the bag and you don't know what the tray number is, that's not a problem. Right there on the molar, you can kind of press it up against something bright and you can see the actual tray number is printed on your aligner. So if you ever misplace it out of the bag, not a problem. You can still identify it just based on the tray. So you are going to move through your aligners in consecutive order, and based on what the doctor has prescribed for you, you're going to either change them every 7 days, every 10 days, every 2 weeks, depending on how many hours of wear that you're getting per day. The typical wear time is going to be 7 days in each tray. So we want to make sure that you're getting 20 to 22 hours of wear in every tray in every single day. So you might come across some stickers that are placed on your individual Invisalign bags, and I'll go ahead and review what those stickers might indicate. So the first one here is the do not wear template for doctor use only. So this is going to be on your attachment template, which is what we use to place those tooth color buildups on your teeth. So you won't ever wear that one. The only time we'll use that is if we're using it in the office to either place for the first time an attachment or replace it later through treatment if one does happen to come off. So you'll want to keep this in your box just in case you ever do need it. If you do need to come in for a replacement, just bring that attachment template with you. The second sticker that you might see is the virtual check-in sticker. If you're one of our patients who's opted into our virtual program through the Grin app, then you might be seeing one of these every 10 to 12 trays. That's just a reminder for you that it's time to send us a scan in the Grin app for us to review. Another sticker that you might see towards the end of your set of trays is the stop, do not wear this aligner until after your visit sticker. You're going to see that towards the end of the trays whenever you're going to have your refinement visit that I mentioned previously. That refinement visit allows us to order another set of trays, and we have specific trays designated for you to wear while you're waiting for those next trays to come in. So we kind of have some inactive holding trays for you to sit in while you're waiting for that set. So we want to make sure you don't go through those before your refinement visit. The next thing you're going to find in your bag is your aligner case. If your trays are not in your mouth, they should be in here. Another thing you're going to find in your bag is an Invisalign welcome letter from yours truly. Just a little encouragement as you're getting started in your treatment, and it also has my contact information. So I know that a lot of things happen over the weekend when the office is closed, so I frequently check my email over the weekend just to make sure that there's nothing that's making you uncomfortable or any pressing questions that you need to have answered over the weekend. So feel free to email me at mackenzie@jamesriverorthodontics.com anytime you have any questions or need any help with anything in your treatment. You're also going to see your Invisalign General Instruction Guide. So this pretty much just reviews everything that we're reviewing in this video. It's going to talk about your wear time, how to clean the trays, what you can eat with them in or out. It also has a little sticker guide for the stickers I just mentioned previously, and it's just a little reminder of what those stickers mean. So we'll go ahead and review some of this information right now. First, we want you to wear your trays 20 to 22 hours a day. Obviously 24 hours would be great, but that would require you to be on a liquid diet, and we're not here to take food away from you during your treatment. So about 20 to 22 hours is going to be your goal wear time. Each individual patient is going to be prescribed a different amount of days that the trays need to be worn. For example, some patients might be prescribed 7 days in each tray, some might be 10, some might be 2 weeks. So whatever length of time that your trays are supposed to be in for, you want to make sure that you're getting 20 to 22 hours in each of those days. If you don't get that 20 to 22 hours of wear in a day, we want you to add a day. So if you have a bad day of wear, add a day of wear. For example, if you're on 7-day changes and you put a new tray in on Monday and you wear your trays 20 to 22 hours on Monday, Tuesday, Wednesday, Thursday, and Friday, but Saturday you go to a brewery, so you didn't want to take your trays in and out and you didn't really get that 20 to 22 hours, no worries. So instead of Monday, whenever you're going to change into your next tray, you'll just change on Tuesday instead, because Saturday was that bad day of wear, so you added Tuesday as another wear day. If you lose an aligner, just give our office a call and ask us what to do. Generally, you're able just to move into the next aligner and wear it for double the time, but in some cases you are prescribed a specific procedure that has to happen in the office before you can move into a certain tray. So if that's the case, we'll let you know and we'll just bring you into the office sooner. But most of the time, if you lose a tray, let's say you lose tray 7, you'll just wear tray 8 for double the amount of time that you would normally be wearing it. So if you're in 7-day changes, you would wear that tray for 14 days. If you're in 10-day changes, you would wear that tray for 20 days, and so on. It's generally not a big issue if you do lose a tray here and there. It just does add some treatment length to your timeline, as well as if you do it over and over, the aligners will end up not tracking and they won't be following along with the teeth. So when you have your trays in, the only thing that you want to be consuming is water. Not flavored water, just plain water. Flavored waters can have acidic properties in them, which can get trapped in between the tray and your teeth and cause cavities or breakdown of the trays. So just plain water is the only thing that you should be eating or drinking with your trays in. It's not necessary to clean your teeth or brush them after eating before putting your trays in, but if you're able to, that's great, just to make sure that there are no food particles left. But if nothing else, just do a quick little swish or a rinse, and then you can put your trays back in. So to clean your trays, you want to make sure that you're not using toothpaste. The exfoliating properties in toothpaste will actually cause abrasions on the trays and then will harbor odor and bacteria. So there's a few different ways that you can clean your trays. The cleaning crystals that come in your welcome packet are great. You can repurchase them through the Invisalign store, or there's also a few easier at-home ways to clean them. One of the ways to clean them is to dilute mouthwash by 50%. We recommend an alcohol-free mouthwash. That way there's not anything that's going to dry the trays out and cause them to become brittle and break. So you'll dilute that mouthwash and have 50% water, 50% mouthwash, and just let your trays soak for about the same amount of time that you're going to brush your teeth. You don't want to do any longer because it can cause the trays to dry out. Another way to clean your trays, and my personal favorite, is a product called EverSmile. You can get this product at our office. You can also purchase it at CVS, Walgreens, Amazon, Eversmile.com. There's several different places. This product will clean your trays, and I also like to use it to clean my case. So the great thing about the case is that it doesn't have any ventilation holes, so if you pop it in your purse and there's still a little bit of moisture from rinsing your trays on the inside, it's not going to leak in your purse or your pocket. But without ventilation holes, that also means that there's a really good chance that there's going to be trapped moisture inside. So to clean my case, I like to take the EverSmile, spray some foam inside the case, do a quick little brush, rinse, and then I like to leave my case open to dry all night while I have the trays in my mouth. The EverSmile cleaning foam can actually be used to gently whiten your teeth and your attachments, but also if you notice that your trays are getting a little yellow or a little dingy, they can bring them back to life. So you just spray this foam either in the trays and then place the trays in, or you can just spray the foam, let them sit while you're brushing your teeth, and then place your trays back in. Another great tip for your Invisalign treatment is going to be the Invisalign app. It's free on the Apple or Google Play Store, and it just allows you to track your trays, track your wear time, and especially if you're not on that consecutive 7-day change, so you're not having, Mondays be your change day or Tuesdays be your change day, it's a little bit easier to help calculate when you need to change your trays. And sometimes we hear from patients that they actually wore their trays longer because they forgot to change them. And we want you to be able to move through and see your new smile transform as quickly as possible. So you can use that app just to remind you to change into your next tray, and it's free. So now I want to talk to you about placing your Invisalign trays in. It's really important that you don't bite your Invisalign trays into place. You want to gently place them with your hands. The reason for this is your Invisalign trays are going to move to wherever you need them to go. So if you're biting them down into place, they're going to conform into whatever area they need to in order to be placed. So for the first few times, it's going to be easiest if you're doing this in front of a mirror, but don't worry, you're going to become a pro very quickly and you won't need a mirror to place them. What you want to do is start in the front and then just gently guide them into place with your fingers. Like that. It's going to be a little bit different than what I just placed because you're going to have attachments on your teeth and you're going to feel those attachments clasp onto the trays. And now for the lower. Just like that. Now to remove your trays, you want to make sure that you're removing them from the lingual side, which is going to be your tongue side. So if you start to pull your trays out from over the top, it's going to start to bend the trays, which will hinder the movement, but it will also move the trays outward. So it's going to be rubbing up against your cheek, which is going to become uncomfortable. So you want to take your finger and go in from the inside. And gently pop them out just like that. Same thing for the lower. And then pop them out. Now, don't let that fool you. I'm in a retainer stage, so I have no attachments and no movement. So yours is gonna be a little bit harder to get out just because you're having to move them around those attachments, but make sure, even though it's gonna be tempting, not to pull them off like this. So if you are one of our patients that opted into our virtual program through the Grin platform, then you're also going to receive this little box. This is the Grin Scope. Inside that box, you're going to see a little bag that includes your Grin Scope. This is a device that is exclusive to Grin and was designed purposefully and intentionally to make sure that it can attach to your phone, to make sure that it fits the inside of your mouth and it is the exact distance that it needs to be from your phone camera to stay in focus the entire time. It actually gives us a fantastic view to see you virtually. So you'll just pull this band out. And this band, you can either loosen or tighten, but it's gonna go right around your phone like this. This portion here is gonna be what's going to go on the inside of your lips like so. And that's the view that the camera is going to capture that you'll submit through the Grin app. Another thing that you're going to see in your packet if you are a part of the virtual program is a separate set of Grin instructions just for downloading the app. You can scan one of these QR codes depending on whether you need the Apple App Store or the Google Play Store, and it's really, really easy to start the Grin process by downloading the app. If you have a virtual appointment scheduled, then we'll send you your login credentials just a few days prior to that visit. The app is free as well as being a part of our virtual program. So if you're not able to get into the office as often as we need to see you, or if you are not local to the Richmond area, or if it's just easier for you to conduct a visit from home, then we invite you to become a part of our Grin platform. That's it from me. You should now have a pretty good idea of what your Invisalign treatment is going to entail, and you are now armed with some great tips and tricks to make the most out of your treatment. We also know that we are sending you home with a set of trays and something to change your lifestyle that you've never done before. So even though we do this every day, we know that this is brand new to you. So please don't ever hesitate to reach out with any questions or concerns, and especially any discomforts that you may have, because we want to make your treatment as positive and as comfortable and as transforming as possible. So don't ever hesitate to reach out to our office. Our information is all in your welcome packet, so you can email us, you can call our phone number, or you can even text our phone number. So the same phone number that you would call, you can even just text, and you can snap a picture and send it to us if you have any questions or concerns. We're so excited to join you on this journey, and we can't wait to see you in the office soon.